Okay, so step 3, you've gone to your databases in step 2 and you've found all the evidence and all the different studies that have been conducted in the area that you're interested in. So step 3 of evidence-based dentistry is to appraise that evidence. This is, I think, the hardest thing for you to do at this stage. It's often much easier with experience. So the more research that you read, the more articles that you've read through, the more experience you have of doing your own research and reading research, it becomes much, much easier. So the more you do, the more it will become easier. It involves 2 stages. Firstly, to assess the quality of the evidence. So is it high quality or is it low quality? And then to bring all the evidence together and synthesize it to be able to make a decision about what you're going to do with that evidence. So let's look at that first one, assessing the quality of the evidence. So in this, this is considering the design and conduct of the research. So there are particular designs of research which we hold as greater because they have more control within them. So I'm going to come back to that in a minute. And also the way that the research has been conducted in terms of methodology, and also how the data has been analysed in terms of the statistics. So this is all to do with critically appraising the quality of research reports. And what you need to think is, whilst I'm going to talk about the different designs that are better, if you like, or we can put more stock by, research is an art of compromise. So there's a compromise between the perfect study that can be done and the best that you can manage in a certain situation. So there's not all questions that can be addressed using experimental methods which have the tightest level of control. So for example, there's an example here, you couldn't use a randomized control trial, for example, to study the effect of tobacco advertising on the incidence of oral cancer, because you can't randomize people to different tobacco advertising conditions. So there's lots and lots of different questions within dentistry that you cannot use experimental methods for. So you have to compromise between what you would like to do and the best that you can manage. So looking at those levels of evidence then, you can see here a hierarchy of different designs. And at the top of the best design, if you like, at the top of that is a meta-analysis, followed by a systematic review, randomized control trial, cohort studies, case control studies, case series, case reports, and then animal research. So they go from the top, the best designed studies, the bottom, the least best designed studies. And so what we want to do when we appraise research is really consider the best designed studies that we can. We can do this by using different types of appraisal tools, and Zoe Marshman in a later unit will be talking more detail about critical appraisal than I will do today. She will be taking you through these different tools for different research designs and telling you how to use them and to give you different examples of them. So I'm just going to briefly mention them today so you're aware of their existence, if you like. The first of these is what we call the Critical Appraisal Skills Programme. And this is a national UK-wide skills programme for medicine and dentistry. Okay. So the Critical Appraisal Skills Programme has different spreadsheets, if you like, for different types of research designs. So meta-analysis, systematic reviews, randomized control trials, case control studies, etc., etc. And it takes you through key questions that you need to consider when you're reading about that kind of design. And so it's a really useful place to start. So if you have a particular study that you need to appraise, download the Critical Appraisal Skills Programme sheet for that particular design and work through those questions to help you appraise it, to see whether it's a good design, whether it's been conducted appropriately, whether it's asked the right research question, whether it's analysed it appropriately. The second of these, the Consolidated Standards of Reporting Trials, the CONSORT, is specifically to do with randomised control trials. And so it takes you through the different aspects of randomised control trials, from blinding to randomisation, etc. And you can see whether the research article that you're reading has followed these key steps. And then the last one here, the Preferred Reporting Items for Systematic Reviews and Meta-Analysis, PRISM, is again something that you can use when you're looking at systematic reviews or meta-analysis to see whether the research article that you're reading has followed the key steps within this PRISM statement. So these are all kind of generic appraisal tools that you could use when appraising research. Let me just say a little bit about why systematic reviews and meta-analysis are seen as the best evidence, if you like. There's a number of reasons for why they're at the top of that pyramid. Systematic reviews and meta-analysis are now considered the most reliable method for summarizing large volumes of research evidence. This is because they bring together all of the research studies that have been conducted within a particular area, so they bring them together within one research article. They can then use a series of tools, whether that be quantitative, i.e. effect sizes, or just a qualitative narrative discussion of the research evidence, and come to a conclusion about whether the evidence supports a particular treatment or intervention. And so it kind of does the quality and appraising for you, and that's why they're seen as really important within evidence-based dentistry. The meta-analysis is a form of systematic review. All it means is that they've carried out a systematic review and they've pulled the results together mathematically. And the meta-analysis can either be within a systematic review or it can be standalone. And because they pull the results together of all these different articles, come to an effect size for a particular treatment, that's why they're at the top of that pyramid in terms of different designs. So, back to those two steps of appraising the evidence. The first is to appraise the quality. So if you know, for example, that within your research, the research question that you've searched on, if all of the evidence are meta-analysis, systematic reviews, or even randomized controlled trials, those kind of designs are the best. That's what you're looking for. And you can put more weight behind them being good quality evidence, good quality studies. If all you have are expert opinion or animal research, which you probably won't have within person-centered research, but expert opinion, maybe case control studies, then it's going to be lower quality. So you won't put perhaps so much trust in the evidence before you. But whatever you have, once you've got all that evidence together, you need to synthesize it and come to a decision. So the method adopted depends on the situation. Obviously, if you have a meta-analysis, then it's done it for you. And so, as I said right at the beginning, the first thing you should do when you have a topic that you've searched on is to go to the Cochrane Library to see whether any systematic reviews or meta-analyses have been done in that area. Because if it has been, then you have that meta-analysis, all the studies have been pulled together for you, and they'll come to a quite definitive conclusion about a treatment or intervention. And so they've done the hard work. Obviously, if there is no meta-analysis or systematic review, then you need to synthesize the evidence yourself. It may be that you just have to weigh up whether there's a number of research articles of good quality that suggest that a treatment is effective against lower quality designs that suggest that it isn't. So you have to weigh it up, and obviously to do that you need quite good experience of different designs of research. You need to be able to appraise research well, and that's why I said that a lot of this is to do with the experience that you have and just the sheer amount of time that you've spent reading research, because you kind of have to weigh it up yourself. So synthesizing the evidence, firstly look for meta-analysis and systematic reviews, and if not, weigh it up, try to come to a conclusion yourself about whether better quality studies do or do not support a particular treatment or intervention. So then step 4 is what you're going to do with that evidence. Are you going to implement it or not, and if so, in what way? The bottom line is that you shouldn't provide advice or treatment without evidence. So if the evidence is poor quality, if it's all expert opinion or case studies, then there's probably not good evidence to suggest that you should provide advice or treatment or change your clinical treatment in any way. That's also important because we shouldn't spend resources on treatment without evidence or good quality evidence. So there's two things, aren't there? There's one about ethical reasons for providing treatment, and the other is about resources for treatment. And this ties into what we mean by implementation. It might be that you're implementing individual treatment decisions, so you're a practicing dentist, you're providing clinical care for individual patients, you've read the evidence, you've assessed the evidence. Does it suggest to you that you should provide treatment in a particular way or not? It may be that the evidence can be used to develop different clinical guidelines for a particular problem or disease, or particular clinical pathways for patients or patient groups. Or it may be that the evidence can be used to inform different payment structures. So there's lots of reasons for implementing evidence-based dentistry, and there's lots of different reasons, and there's lots of different appraisal mechanisms to help you reach that goal about whether or not to implement. So let me just take you through an example. And so you're a practicing dentist, you have your own clinic, and a dental rep from a local company comes to your practice trying to sell you a new machine which he says uses ozone to treat caries. And obviously these machines are very expensive. It may be that your clinic is has a lot of resources. It may be that you can spend those resources on trying these new types of equipment. But probably more realistically, you need to weigh up whether it's going to be effective for a large number of people before you decide whether you're going to pay for it. So what you need to do is you need to go and see whether there's any evidence to suggest that ozone can treat caries. So what you need to do is go back to your 4 stages of evidence-based dentistry. So what's the question that you want to answer? You need to locate and collect that evidence to answer that question. You need to appraise that evidence, and then you need to implement it, i.e., are you going to buy it or not? So define the question. So well, it's unlikely that you're going to know from the top of your head probably whether ozone works in the management of caries. It may be that that's something you know, but most often case, it's something that you're going to have to go and find out in the evidence base. So is there any reason to suggest that ozone might work in the management of caries? It may be that O3 gas is toxic to certain bacteria and fungi in vitro, so it might kill it off. In which case it might suggest that the application to caries might be that it might reduce the number of carcinogenic bacteria, or it might halt the decay with fluoride and allow remineralization. And so what you would need to do, if you've got those sort of thoughts about the possible ways in which it might work, is to put it into the PICO format, and then you can go and search for the evidence. So you've changed your question into the PICO format, so that's patient population, intervention, comparison, and outcome. And you've gone to those electronic databases that I talked about earlier. So first off, you've gone to the Cochrane Library, and you've found that there's one systematic review carried out in 2008. So this is called The Application of Ozone in Dentistry, a systematic review of the literature, published in the Journal of Dentistry. So you are going to go and find that and read it and see what evidence they collected within that systematic review. So within that systematic review, it suggests that in vitro there's good evidence of ozone biocompatibility with human oral epithelial cells, gingival fibroblasts, and periodontal cells. So there's good evidence to suggest that ozone might work. However, there's some conflicting evidence of its efficacy, and particularly for the application of ozone in endodontics. And there's insufficient evidence for the application of ozone in oral surgery and implantology. And in vivo, the clinical application of ozone in dentistry has not achieved a strong level of efficacy and cost effectiveness. And this is just basically saying that there haven't been enough studies probably conducted in this area. And so what the systematic review is saying is that actually in vitro, there's some aspects of it which may be good for caries, but actually we haven't got enough evidence at the moment to suggest that it's clinically effective in vivo. And the systematic review, collecting all of the evidence to date in that area, suggests that while laboratory studies suggest the promising potential of ozone in dentistry, this isn't being realised in clinical studies to date, which suggests that there's just not been enough clinical studies. And that more well-designed and conducted double-blind randomised clinical trials with adequate sample size, limited loss to follow-up, and carefully standardised methods of measurement is what's needed. So what does this suggest to you about whether you would go ahead and buy that machine for your own clinic?